I have worked my whole career with adult survivors of incest and child sexual abuse or other forms of childhood trauma, and many of them have very deeply internalized voices and shadows, I guess, of their experiences that really affect them over their whole life. And I've been working with folks who have been suicidal at different points in their lives, and it's very related to what happened to them. And the first time that I got introduced to voice therapy was several years ago. I attended a workshop that you did at the American Psychological Association, and I was just really taken by the work of the voice and its significance, because I was looking at intergenerational transmission patterns of, in particular, incest, but all types of child abuse. And the voice really, I think, is a patterning that goes from generation to generation, and you showed it so beautifully of how it can impact someone's self-esteem, their sense of self, their self-capacities, their self-regulation abilities. And it really illustrated for me why some people would be suicidal, because the messages that they may have gotten, the voice they may have gotten was, you know, I didn't want you to be born. I wish you would be dead. I wish you'd off yourself. And I think that comes across in many different ways in families that don't function very well. I had a patient who was talking about her daughter in extremely disparaging tones and was saying that if the daughter got pregnant, that she could virtually go hang herself. And the patient did not recognize that she was saying anything that was abusive, but clearly it's a very abusive and denigrating message that she was giving her daughter about if this were to happen, then, you know, all bets were off. And we stopped and really talked about that, because that message could be so deeply internalized and could be acted out. And the mother had no sense of that whatsoever. And this was a mother who was very dysregulated herself, had a lot of problems herself, and had some problems in her own childhood, in her own adolescence, that she was transferring onto her daughter, and in this particular way, and in a way that was totally unregulated, and didn't see her daughter as differentiated from her, just saw her as an extension that if she were to get pregnant, that would be the kiss of death. It was very shocking that it was verbalized in that way, and then there wasn't a recognition of how, what power that verbalization might have. And in fact, she had told her daughter that on many occasions and just skipped that it would have any impact whatsoever. So we brought that back to her attention to try to do some repair work around that. But I've had many cases where patients will cry and say, you know, my mother and father said that they wish they had aborted me, or they wish I'd never been born, or, you know, they wanted to get rid of me some way, or that this is how they behaved towards me. No.
And they've internalized that as a voice.
Yes, they've internalized that as a message, and a very shaming message that they need to act out. And then on top of that, with that type of negative attachment or insecure, disorganized attachment experience, they have no capacity for self-soothing or self-regulating, so they're carrying around this painful affect, and the message, the voice is in their head, and the voice is replaying, and there's no way to reverse it. And I think that in many ways that the suicidal patients that I've seen are acting that out in, you know, because it's so well internalized without a lot to fend it off. And they're in very painful affect states. And I do talk to patients and use that famous phrase of suicide as psychache, that, you know, they're really hurting and they're really aching in their psyche, and it sort of pulls them up short to have somebody empathize with that, and somebody to really understand that they're in a great deal of pain. They don't know what to do to end the pain, except to end it. And this idea that, you know, there's something that gets conveyed intergenerationally from parents who may have heard it from their own parents, and that is just transmitted. And as you know, some families solve their problems by the different members suiciding. And so it becomes sort of a way to cope, albeit a really extremely dysfunctional way to cope. but the message may be there. You know, that's how the family has learned to interact with one another, is to be in great disregard or devaluation of each and every one of them, which is the opposite of what we would see as secure attachment or mental health in a family. Mm-hmm. You know, rather than being cherished, these children are, you know, pushed away and given messages about their being hated